It's my job as an oncologist to save as many lives as I can. I don't take this as a job, it's more of a calling to me. So it's very hard for me to see patients refuse care because they cannot afford it.
I'll never forget the day I had just started becoming a patient advocate. About 6 months into the job, I had to give a cost estimate to a patient that had Medicare only. And she looked at me dead in the eye and said, "That costs more than my casket, and I will not put that on my family." And she got up and walked out that door. I swore to myself I would never let that happen again. I made it my responsibility that before I ever presented a cost of care to another patient, I would research to find all of the assistance and grants that they could possibly qualify for. However, in the past 3 years, finding funding has been more challenging than ever. And there are now 4 types of cancers where my patients almost have no access to financial assistance.
Lung, colorectal, esophageal, and head and neck cancers. Not only are there limited financial resources available for these cancers, these patients require surgery, radiation, chemotherapy, which could either be in the form of oral chemotherapy or IV chemotherapeutic agents, as well as newer drugs such as immunotherapy, which could be extremely expensive.
I want my patients to be able to focus on healing. They shouldn't be questioning if their life is worth fighting for because of the financial burden on their family.
Francie came to me and said, "Why don't we change this? If there are limited funds for these patients, why don't we start a new fund?" And that's what we're doing. We're spearheading a fundraiser so our patients can finally have some financial relief.
100% of all proceeds donated are going to serve all our local cancer patients fighting. Anyone can apply to receive funding as long as the funding is there, and that is where we need your help.
Cancer can set you back, not only with your life, but with your finances and your family's resources.
If we all come together and give what we can, for some it could be thousands, for others it could be the change in their pockets.
Our goal is to try and be able to help our patients to the best of our ability so that they don't have to go through this thinking, how are we going to be able to pay our next bill?